Thanks for listening to the Wild Health Podcast. For the foreseeable future, you're not going to hear our normal intro or outro here. We're going to be releasing episodes very frequently as things are changing. This channel will be used for a very specific purpose. Number one, to communicate with our patients. We're somewhat overwhelmed, and the more we can communicate breaking news and recommendations from us to our patients all at once, the better. So if you're a patient, we're here for you if you need us, but if possible, please tune in here so we can both keep you up to date and conserve our time for the most critical tasks. Feel free to share this with friends and colleagues as well. Number two, we've organized as a group. We have infectious disease specialists, ER doctors, critical care doctors, and in total dozens of MDs, PhDs, and frontline clinicians who are going to be constantly evaluating the news and emerging evidence. We're then going to summarize and translate that for you here every day on the podcast. The speed of change with the circumstances will make us look foolish at times, but we're committed to pouring all of our resources and energy into doing what we can to help and make a difference. You can also follow our updates at wildhealth.com or our Instagram account at wildhealthmd. And if you're a patient, we're here for you. Please tune in here for the updates and let us know how we can help. Mike, it's March 28th, Saturday. How you doing?
I'm doing all right, Matt. How are you doing?
Good. I'm actually sitting in my car. As you know, I live in the woods now. It's actually been a pretty awesome day. I've been playing in the woods with the kids. We've been hunting tadpoles. I think our last count was 43 tadpoles and 2 salamanders that we've captured today. So it's been a good day so far. The problem living in the woods is like right now our internet is not working. So I've driven up on top of the hill in my car. So I've had a nice day, but looking at these numbers, this kind of snap back to reality is not great. So you want to go through the update for today?
I'm happy to get into it. I've had a pretty good day too. I've been hanging out with the family. Took most of the morning off. We decided to start doing a daily challenge just to try to get our minds off all this craziness for a little bit. So today's daily challenge was a max time hang from a pull-up bar, just a dead hang from a pull-up bar. So turns out I can do it for about 1 minute and 43 seconds. And I think my daughter's probably just a little bit better than I am. I'm not going to give her time, but there's an advantage.
She's like 7 pounds or something. Though. Yeah. She's tiny.
There's an advantage to being light for sure.
Yeah. We do have to keep sane during this time. We released a podcast this morning with Dr. Kristen Dawson, our director of mental health, on some science-backed ways to do that. And tomorrow morning, we're actually releasing a podcast that we did with Ben Greenfield just on his tips and what he's doing to stay sane. I'm not sure if you could ever call Ben sane, but to not go more insane, I guess, if you're somebody like Ben.
Yeah, it's certainly important, especially when we're constantly diving into these numbers. So just to get to it, today is March 28th. And right now it's currently 3:30 p.m. Eastern time. The CDC, as we mentioned in last week,
it's actually 4:30 Eastern time.
I'm on Pacific. There's a lot of math there. Just like last weekend, we noted that the CDC does not report numbers over the weekend. So as of this morning, Johns Hopkins was reporting 104,000 cases confirmed and 1,709 deaths in the U.S., which was a 23% increase in cases and a 31% increase in deaths from the day before. Case fatality rate is still 1.63%, so a little bit of an uptick in the case fatality rate. If you look at Worldometer as of the time of this recording, currently we're at 119,000 cases and 1,988 deaths. 728 of those deaths are actually coming from New York, and the 4 highest deaths being reported are New York, Washington, Louisiana, and New Jersey. The highest doubling rate right now is actually coming from Louisiana, with a doubling rate yesterday of 30%, or 30% increase in deaths, which is about 5% greater than New York's. Globally, the U.S. continues to have more confirmed cases than any other country in the world, and is the only one so far to have surpassed 100,000 cases. Data from the Financial Times shows the U.S. death toll remains steep, doubling every 3 days. Spain, however, has the highest growing death rate and is the second highest death toll in the world after Italy. Both Spain and Italy reported new daily records in the past 24 hours, with 832 deaths in Spain and 969 in Italy.
In U.S. news, the hotspots tend to be moving inland. 17 states now have more than 1,000 cases each. Chicago, Detroit, and Milwaukee County, Wisconsin, seem to be facing some really big numbers and explosions in cases there. There's 233 million people. About 70% of Americans are under stay-at-home orders from either state or local authorities. Yesterday, President Trump announced that he would be invoking the Defense Production Act to commandeer General Motors factories and supply chains to produce ventilators. Now, General Motors had announced earlier in the day that they were already working towards manufacturing ventilators, even in the absence of a federal contract from FEMA. The United States Conference of Mayors surveyed officials in 213 municipalities across the country and found that the majority are facing a severe shortage of medical supplies. More than 90% of cities said they do not have an adequate supply of face masks for first responders. 92% reported a shortage of test kits, and 85% reported an insufficient supply of ventilators at local hospitals. I'm not sure what this looks like on the ground for you, Mike, there in Oregon, but here in Kentucky, I just got a message from the ER that I do most of my shifts in today, and they told us that we were going to get one mask per shift. Don't get it contaminated. Use it well and use it always during your shift.
We've actually been using one mask for multiple shifts, or at least I have been. So that lots of conservation. I know that we've got quite a number of masks, but we're expecting a wave in the future. So trying to conserve as much as possible.
And if you're a medical provider, we did release a couple days ago a podcast with Dr. Brian Atkins on how to conserve that PPE and maybe some things that you can do to sterilize it. I mean, none of it is really backed by hard science, but there does seem to be some things like UV light and some other things that may help, and we're getting more and more data on how to do that. So hopefully that shortage or our methods for sterilization are going to get better in the near future. The New York Times reports that an early hotspot in New Rochelle, New York, may be showing signs of successfully flattening the curve. 2 weeks ago, after a cluster of cases were identified in the city, the state enacted drastic measures, including strict social distancing rules, aggressive testing and confinement orders, and creating a 1-mile radius containment area around the source of the outbreak. Now the outbreak appears to have slowed, with only 38 new cases being reported over the last 4 days, and experts remaining hopeful that the rate of new cases will continue to slow. So I thought this was really interesting in that this one area in the United States seemed to be doing some similar things to occurred in Singapore and some of the other places that really took drastic measures and really went after this hard. Places where we saw the curve was actually flattened. So it's kind of a test case for us in the United States where we really don't do well with kind of taking orders and restricting freedoms. But at least we have this test case that maybe some of those things work. So we're going to continue following that. But I think it's going to be really important that as this moves and we get different hot zones in different places, we learn from the mistakes and the successes of places that have went before us.
Absolutely. I've been seeing a lot of discussion in social media and a couple of articles recently, Matt, that have been talking about this concept of reinfection, which I know we've talked about a little bit on the podcast previously, but I wanted to mention it again. There was a quote from an article in NPR that was released yesterday on the 27th, and the quote is, based on data from several quarantine facilities in the city, they're talking about Wuhan, which house patients for further observation after their discharge from hospitals, about 5 to 10% of patients pronounced quote-unquote recovered have tested positive again. So apparently most of these patients are asymptomatic, which the concern is could potentially lead to asymptomatic transmission and basically a second wave within the province in China. This was something that is interesting because Carrie Gunn, who's the founder and CEO of Genolite, which is the company that's offering the COVID serology and some of the rapid testing for COVID. So he actually estimated, and this is not data that has been published, but this is just on their experience with the serology testing, that approximately 10% of people are not forming IgG antibodies after the COVID infection. The reason that I find that concerning is, I guess, because the numbers are very similar. So in this article from NPR, they're saying that 5 to 10% of patients were pronounced recovered and ended up testing positive again. And also in separate data, this founder and CEO of Genolite is basically saying that around 10% of people are not forming IgG antibodies. So I guess this means that it's possible that 10% of people could get reinfected with the disease after getting it. And I want to be clear that there's no data to technically support that, and many experts believe that that's those second infections and the Chinese patients actually represent just inadequate test characteristics of the initial tests that were done. So likely they were false positives either the first time around, or they're false positives the second time around, and that's not uncommon with these sort of nucleic acid tests. So it is certainly possible that that people are getting reinfected. However, we just don't have the data to say for sure.
Yeah, and I think it's important, Mike, you started that with saying this is unpublished data. And the reason we say that when we talk about things like this is not to say, hey, we're breaking news, but it's to say it hasn't gone through the regular peer review process. We don't know how true and accurate it is, how big the numbers are, what the methods were for collecting this data. So we're in an interesting situation where getting information out fast we feel like is important, but at the same time, we need to be a little bit cautious with unpublished data because we don't just know how it's collected, we don't know how we get to those numbers, and we don't know what it means in all cases. Sometimes there's a good explanation that we're not thinking about, just like what you hypothesized with the testing. We really don't have great statistics on what are the operating characteristics of this test. If we have low specificity, meaning we have a lot of false positives, the number of tests that we're doing, it means a lot of people are going to test positive, they don't have it, and then later they get it. That's not a reinfection. That's just an issue with the test. So Monday, not to dive too far into testing now, Monday we're going to get a testing update from Dr. Taylor Bright, who's a PhD in infectious disease and genomics. He's our director of infectious disease. Our test that we're doing as a company, he has spun this test up in our lab, and we tested it on Friday. The test seems to be working, so we're going to be bringing that out soon. But we want to talk to him about also some of the antibody tests where we could potentially look and see, do you have immunity? If you develop the antibodies, you're going to have an immune response, which we think could be really interesting in the near future to be able to test medical providers and others to see who's immune, maybe who could be on the front lines working in a little more of a safe manner.
I don't think that it's just going to be interesting. I think it's going to be absolutely necessary. I mean, we're basically talking about a disease where we don't have the adequate number of tests that we need. So people who are symptomatic can't even get tested most of the time to find out if they've had it and developed an immune response, or likely developed an immune response. But we're also looking at a situation where there's people who are asymptomatic, who are contracting the disease, likely creating an immune response, and are likely able to go back to work even though they had an asymptomatic infection. So we're just flying completely blind on who's truly had it, what the total numbers are. I mean, I know we've gone over this multiple times, but this to me speaks to why serology is going to be so important with this disease and getting back to some sort of normalcy in our daily lives.
Yeah, and what I see happening with the frontline providers, it does seem like they're being taken out right now. We see that in our colleagues who are testing positive and first responders in New York, and we're going to talk about a way to support first responders later in the podcast. But I think what's going to happen is as people are dropping out of the workforce, there's a larger burden on those of us who haven't gotten sick yet, and the hope is that as the kind of numbers dwindle, we'll start to kind of get back online. We'll be able to kind of, okay, you've been sidelined with an injury, if we think about this as a sporting analogy, and then you recovered. Now you're kind of like Wolverine. You can't get infected, or there's a lower chance, and then we can kind of put you back in. So I think that's a lot of our hopes. But to have a test to be able to say that would be very helpful.
Certainly. After this first wave, I think those providers that have recovered from COVID are going to likely be the ones that, are the most, are the least vulnerable and the most apt to being on the front lines. But that's a bit in the future. Another article that I wanted to go into briefly was one that I saw on something called the COVID-19 Host Genetics Initiative. This is interesting. We've talked a lot about potential genetic polymorphisms and how they might relate to COVID infection. And it looks like some people are actually getting after it. So this initiative is collecting human genomic data, looking for basically alterations in genetic code for genes related to COVID infections, like things like ACE2, which we've talked about multiple times on the podcast. So far, 2 large genetic genetic banks, FinnGen, which has DNA samples from about 250,000 Finnish people, as well as 50,000 participant biobank at the School of Medicine at Mount Sinai, have agreed to participate. And it sounds like Decode, which is a company out of Iceland and currently testing the entire country, as well as the UK Biobank, have also agreed to contribute somewhere around 500,000 samples. So the data combined with COVID infection and outcome data really could prove to offer some significant information regarding the influences of genetic variation on just things like disease progression as well as infectivity. So this is obviously something that we at Wild Health are really interested in, just because we spend so much time talking about genomics. We even talked with David Sinclair a little bit about trying to do our own smaller study. With giant groups like this getting after it, I think we're likely quite far behind them in terms of collecting that data. But as soon as we get some information from them, we're certainly going to be using it to help identify our patients who might be at greater risk. The last thing I wanted to mention was interesting. There's been a couple of cases of patients who have presented basically with having a heart attack and have turned out to be COVID positive. So this is more along the lines of, this disease is just really challenging in the sense that it's presenting in so many different ways, and providers on the front lines, I think, are having a lot of trouble, figuring out who's potentially a COVID patient and who's not. And these patients, some of them actually presented with an EKG that was consistent with an ST elevation MI, which is sort of like the classic presentation for a heart attack that it's hard to imagine doing anything other than, either giving thrombolytics to or taking to the cath lab to get a stent placed. And it turns out these patients have normal arteries, and they're actually just succumbing to myocarditis from their COVID. There's some early reports that this happened to a young man in California. There's been several other descriptions of it in the news so far. So just another warning to the first responders and the people on the front line seeing patients in the emergency department that this disease has many faces. So we have to be very aware of that.
And Mike, I've got a few more hours of daylight, and I'm woefully behind on my goal today with my 8-year-old and 10-year-old of catching 100 tadpoles. So I'm going to get back to tadpole hunting. But we want to end today's update with a video that we're going to replay that we recorded with a philanthropist who listens to the podcast and came to us asking how he could help, what he could do. This is someone who does a lot quietly and privately, a lot of giving. But we asked him to talk about this, to basically issue a challenge. We think that there needs to be a massive collective focus on taking care of our frontline providers and the resource that is for us, and he agreed. So we interviewed him, and we're issuing a challenge to all of America. So watch the video, listen, and then let us know how you're going to respond to the challenge, either on Facebook or Instagram at Wild Health MD. And we'll talk to you tomorrow. So Papa John, thanks for spending some time with us. You were very hesitant to talk about this. You have done a really great thing, and you wanted to kind of do it quietly and just do the good deed, but I convinced you to talk about this because I think it sets an incredible example for other people, and I think it's good to get this message out. So just to let everybody know what you're doing, you are sponsoring food for pre-hospital providers and those on the front lines who are really fighting COVID. And I think it's a beautiful thing to do. Tell me, where did you kind of get this idea? Why are you doing this?
Well, thanks for having me, Matt. It's obligatory to give back. And I think, like all of us, I feel kind of helpless. I mean, what do you do? How can you do something to better mankind in what is really a horrific situation? And our goal has been to make other people's lives better, to improve humanity. And no matter what we do, you and I always come back to that. And so when I was sitting at home, twiddling my fingers with nothing to do, I go, how can we do something? And what more important, methodical, logical step, and not help the people that are on the front lines that are fighting this thing. They're really the unsung heroes here. So it's a privilege, and just hope we by doing this we make a difference. We make humanity better.
You texted me one day, said, "Hey, I want to help. What can I do to help?" And when I responded, "What about pre-hospital provider?" You didn't hesitate. You were on it. You just said yes, and you're writing a nice size check to actually feed pre-hospital providers, and that's been one of our concerns for a while now. If something happens to these pre-hospital providers, our ER nurses, techs, paramedics, firefighters, police, we're in a lot more trouble than we are right now. So I think it's an incredible thing you're doing. We, I think, have been kind of blessed with so much already. I think it's really nice to see when everyone's hurting right now. The stock market's down 30%, and the fact that you could just be sitting at home watching the stock market and all these things, but instead, even though you're hurting like everyone else, you're giving back. And I think that that's a really cool thing to do. The reason why I was able to convince you to actually talk about it is because we thought we could have an even bigger impact if we challenged other people. So do you want to talk about the challenge that you'd like to make?
Yeah, but you're being modest. Let's put it in context here. You and I were talking, what do we do here? What do we do to help out humanity and mankind to get, we're really not going around this thing. We got to go through this thing. And so I felt guilty watching you working literally 24 hours a day, not sleeping, and I'm doing nothing. It's just not the way I was raised. So when you came up with, hey, you may want to look at this, and we kind of, thought about what's the best way to go about this that could have the most impact and do the most good. We thought about the people on the front line, and you know me, I'm principle centered and principle oriented, and I don't like asking somebody to do something that I wouldn't do. When people are actually going out, what happens to our frontline? What happens to us when our frontline defenders, are not strong? And so, and then I like to do things on a bigger scale. And I thought, well, if we could take Wild Health and all the great things that you all do, your all's podcasts are the best in the business. You don't need to look at all these other things going on. If you just listen to you guys pretty well cut right to the chase. We look at getting involved with Coach Cal in the university. It just seemed like everything fit and just a good idea. And we felt like if we could start this and make this a nationwide, at least thought, top of mind, that let's do something for our first line responders, then we'd be doing something really, really good and really, really big. So that was the thought process that went into this.
Yeah, and I've heard you say you don't want any credit for this. You just want others to follow the example. And so the challenge that you kind of talked about, I thought sounded great. If there are people that have resources and are able to provide food and meals for pre-hospital providers, police, fire, nurses, ER, techs, and physicians. For example, a food truck was an example that you gave. There's a food truck doesn't have work to do right now. That's a small business that's out of business, and there's someone that has resources, like you have resources, teaming those up to actually provide meals could be a really cool thing. And even though those people who have resources, they have a lot less now than they did a month ago with the stock market and the economy. I think that the test of a lot of people's character you're going to see right now is when you're hurting, you've lost like everybody else has, you're hurting, being able to give and continue to give and help others who are hurting even more. I think that's really we're going to see people's character through this. And so that's the challenge we wanted to kind of make. If you have resources, find a small business that has resources that could help out in a pre-hospital way, whether that's maybe a factory that could make masks, a food truck that could provide food. We have a restaurant and a kitchen and chefs here, and we can cook the food, and you're providing the resources and sponsoring it, as well as Coach Cal is also. And we think that there are a lot of people around the United States that want to help and that can help. And so we want to kind of issue a challenge on social media. I don't know what we're going to call it, maybe the Papa Delivers Challenge, or we got to get Coach Cal involved, so the Papa Delivers and Coach Cal with the assist or something like that. Challenge we can put out on social media and really just have people continue to do this. And if you're a person that doesn't have resources, you don't have money, you don't have a food truck, you don't have a warehouse, what I would encourage you to do is, we're making little sacrifices here. People out on the front lines are, as fearful as things are and as bad as they are making real sacrifices. And if nothing else, call someone you know who is a paramedic, fireman, a policeman, an ER nurse, and ask them, what can I do for you? Maybe you can just cook food at your house and deliver it to their house. So that's one less thing that they have to worry about. Their family eating while they're working overtime and extra time. We saw on the news yesterday that frontline providers in New York City are testing positive at a really high rate. That means the other providers are going to be working that much harder. That means that's that much less time at home with their families. And just people in those communities, just your friends and family, if you can just do small things, it's going to add up. We're a big nation. If we all come together, we can make a big difference.
Yeah, I think you make a great point, Matt, is that let's flip this on its head. In this situation, which is horrific, I mean, this is like something the world has never seen. Right now, we can't look at the frontline folks, the folks doing the battle, as a nicety. It's a necessity. Mm-hmm. And if we lose that front line, this is not going to be good. So anything we can do to support, help, and give them the concern and care that they deserve, I think it's paramount. I really do.
That's another way to look at it. It's a great point. Those frontline providers are a resource that we have to have right now. So this is not, don't think of this as an expense if you're helping out. This is an investment.
Yes.
An investment that isn't going to pay off just in dollars, but it's going to pay off in lives saved. Yeah. And the U.S. as the economy, and more importantly, the health of our nation, it's going to pay off. So this is an investment. All of us right now, thinking about what to invest in with the stock market down and everything else, invest in ourselves, invest in our people, and that most critical resource we have right now.
Yeah, I've never seen a situation where if you do right and you're honest and you care and it's the right thing to do, where it doesn't come back. And of course, the opposite's true with that too. So, we've been blessed with a lot of materialistic things through the years, but we've been blessed more with the people that we have around us, around me, and so I'm most thankful for that. And the work that your team, Matt and Mike, and Wild Health is doing is incredible. It's going to make the world great, and my hat's off to you all, and we're just glad to play just a small part of that. So thanks for letting me help.
Yeah, I was talking to my dad a couple of days ago when they announced the stimulus plan, and everybody's going to get a check. And when we were talking about it, he made the comment that he's like, I think I'm just going to give mine away. And it was kind of, at first I was taken aback by it because everybody kind of needs it in this time. And he made the statement that that's really the test of character, is what people do when they're scared and when they're hurting. And he is kind of my ultimate role model, the person I look up to most. And to hear him say that, I realized that he's not the only person thinking that way. You're thinking that way right now. Other people want to help, and I think if we come together, if everybody gets these stimulus checks and they're using that to take care of themselves, but then also invest in those frontline providers and invest in each other, I think we're going to be much stronger as a nation.
To do the right thing to the right group of people, frontline folks at the right time, I think that's an easy one.
So think about how you can contribute to first line providers, this great resource we have in our nation, and take the Papa Delivers with the Coach Cal Assist challenge.
Where'd you come up with that?
I guess we'll call it.
That's pretty good.
And on social media, share. Let's see if we can all kind of come together and really help each other in this time when we need it most.
Thank you, Matt.
Thank you. Okay, one last thing. What is Wild Health doing in this challenge? Well, we're committing to take care of any frontline providers for free for at least the next 2 months, April and May. If you're a firefighter, policeman, ER nurse, ER tech, ICU provider, or just on the front lines taking care of people, we can provide telemedicine healthcare for you for free. Sign up at wildhealth.com. Just make a note when you sign up of what your job is, and someone will call you as soon as possible to get you signed up. Thank you so much for what you do. We're all with you. We have your back.
Thanks so much for listening to this COVID-19 update. Please send us your questions or follow along on Instagram and Facebook at Wild Health MD. And just to be clear, this is not medical advice. No patient-physician relationship has been established, and this resource is really for general informational purposes only. And finally, if you want to spread the word, please send this podcast to friends and family and give us a review on iTunes. Thanks again, and stay safe.